Good morning. My name is Andreas Chandra. I'm the district leader for CVS Pharmacy here in central Pennsylvania. Today I'd like to thank Pennsylvania State Representative Tom Mehaffie and the Dauphin County Commissioners Chairman Jeff Haste, Vice Chairman Mike Prees, and Secretary George Hartwick for joining us today. I'd also like to welcome all of you to our CVS Pharmacy here in Middletown. Today we're here to discuss the many ways CVS Health is helping to fight opioid misuse and abuse, and the work we can do together with Representative Mehaffie and local officials across the state. From raising awareness from the importance of safety medication disposal, to educating young people about the dangers of prescription drug abuse, and increasing access to life-saving overdose reversal medications, CVS Health is fully committed to help address the nation's opioid crisis. Our latest effort in Pennsylvania is the installation of the drug disposal units in all of our CVS pharmacies across the state. By the end of the year, we'll have 106 units in this state alone, including 2 here in Harrisburg. Since 2014, we've been working with local law enforcement to provide opportunities for people to safely dispose of unwanted medication at more than 979 police stations nationwide, 135 here in Pennsylvania alone. Through our national effort, we've collected over 899,000 pounds of unwanted medication across this country. Our safety medication disposal program is one of our many ways of prevention-focused initiatives. As you may know, pharmacy robberies have also become an unfortunate side effect of the nation's opioid crisis. The safety and well-being of our customers and our employees is our highest priority. Taking steps to prevent the theft and diversion of controlled substances is an important element in our work to address opioid misuse. For those reasons, we have put security policies and procedures in place at all of our stores that we regularly review to ensure effectiveness. In 2015, we installed time delay safes in the Indianapolis area, resulting in a 70% drop in pharmacy robberies. Since then, we've also expanded these technologies in a few other states and have seen success in those communities as well. Here in Pennsylvania, we've installed the time delay safe technology in every single one of our 525 CVS pharmacy locations and in our pharmacies inside Target across the state. Time delay safes have successfully demonstrated they deter pharmacy robberies by electronically delaying the time it takes for pharmacy employees to access the safe. The time delay cannot be overridden. We've also placed signage throughout all of our CVS pharmacy stores in Pennsylvania to alert potential robbers that there are measures in place that prevent these pharmacy employees from opening the safe on demand. We believe this step is a meaningful contribution to our efforts to prevent prescription drug abuse and diversion here in Pennsylvania. Now I'd like to invite Pennsylvania State Representative Tom Mehaffie and then the Dauphin County Commissioners to say a few words on preventing prescription drug misuse and the work they're doing to help address the state's address the challenge. Thank you. Representative Mehaffie.
Thank you.
Yep. Excuse me.
Thank you. I'm State Representative Tom Mehaffie, and we are in the 106th District. I'd like to thank everybody for coming out today, the commissioners and CVS for what they've done here. This is an important first step for all of us, not only the first step, but a step to do and get this under control. This does not happen, and we cannot conquer this problem we have with opioid addiction without having a public-private partnership. And our county officials have done a great job stepping forward and taking care of what they need to do. I think the state has done a great job this year of advocating and getting things in place, but having a private partner come forth and do what the CVS has done is so important to this community and throughout the state. So I look forward to working with CVS. I look forward to working with others that want to step forward and do these initiatives and make sure that we can get this under control and abolish what has transpired over the last many years with the heroin and opioid addiction. Having it here locally, I hope that all of our folks and our constituents take advantage of this and get rid of right here in this box their prescriptions that are no longer being used. And I think it's important that it's disposed in the right way and help our police forces out and help those that are out there that have something that should be getting rid of it. So I want to thank again CVS, the county commissioners, for being here in the district, and I look forward to working with them throughout this initiative. Thank you so much. And I'd like to turn it over to Commissioner Jeff Haste.
Thank you, Tom. First, I want to start by saying a special thank you to CVS for stepping up in this. You know, one of the things we've heard across the nation for a while is the misuse and abuse of opioids, and it's good to see that a pharmaceutical company has stepped forward and is helping us, particularly in this area. Back in 2013, Dauphin County saw the need for this, and we worked with our local community and installed 9 drop boxes throughout the county. It started out, the usage was slow. Last year we had 2,231 pounds turned over here in Dauphin County, and to date we're up to already 1,449 pounds. So that trend continues to go on. What makes that so important is each single day within our country, we lose about 7 people on average to an opioid death. In Dauphin County alone last year, we lost 128 individuals. And if you think about that, that rate could have been a lot higher if it hadn't been for our first responders, our police officers, and everybody else that's out there with Narcan. If you take Narcan out of the mix, that number would have been drastically higher. And, under George's leadership, we had a number of town hall meetings throughout the county a couple years ago. And to hear the stories of the effect that this has on families is tremendous. It's not only the loss of that individual and that life, it's the ongoing impact that has on that family that year after year after year causes that. I actually talked to one family who had lost a son to an opioid addiction, and within a year had lost a second child because of suicide, could not get over the pain from the first one. So for CVS to stand forward, actually I have to say this on a number of occasions, CVS has been a great partner in this community. This is just another example of that, but this is a life-saving, very important one, and I want to say thank you.
Thank you.
Commissioner Hartwick.
Good afternoon. First of all, thanks to CVS for being a partner. I think they were partnering with us to even put those initial prescription drug drop boxes in various law enforcement agencies once we talked about this. And if there are a 5 times more likelihood of you dying from an opioid overdose than it is from a gunshot, why are we not securing our drugs in the way that we should and are many times securing our guns? The idea that somebody may be into your cabinet, they may access these drugs if they're laying around, and there was a history before the prescription drug guidelines and the prescription drug monitoring program of overprescribing medications. That's why we've seen such a sort of a return, and you're talking about the kind of pounds of medications that have been returned. But make no mistake about it, I was just talking to a relative of mine who was talking about what was in his medicine cabinet. He only lives right down the road in Highspire. So the idea of getting this information out from the media's perspective, that this exists right here in a place where they probably do business, is critically important. And as you know, there's not one single panacea or one single thing that's going to solve the opioid crisis. It's a multi-pronged approach, from Narcan to the ability to do warm handoffs, the ability to also deal with medication-assisted treatment, and the ability to provide behavior modification and real treatment. But a big component to that is for somebody to not have access to those drugs, and the simple fact that they might be able to do it in your grandmother's medicine cabinet. And the idea of educating folks of the importance of getting rid of and disposing those drugs. And it's also really important that we don't put them down the toilet or into the water supply, but yet dispose of them appropriately in these prescription drug drop boxes. So today I want to give a huge kudos to CVS in adding to what we've been able to do throughout the county and law enforcement offices. And there's sometimes where folks may have access to these drugs, they don't want to drop it off at a police station. They're concerned about, even though there's a Good Samaritan law, they don't want to go and drop a whole load of opioids at a police station. You can now do it here in a CVS where you're not under the threat or concern of having any kind of law enforcement consequences. So I think the easier we are able to provide access to dispose of these drugs in the appropriate way, and the ability for us to continue to educate our public about the importance of not having these things in your medicine cabinet. And let me tell you, if you don't believe it's happening, folks, friends of your grandkids, friends of friends are, searching who may have some level of addiction in your medicine cabinets. And it's not a matter of trust or you're being taken advantage of. Do the safe thing. Make sure you take those unused medications that are no longer used for whatever injury that you were in the position to have to take them, and return them back to a local drop box. And now with CVS partnership, we certainly have added to that, and we're grateful for the partnership. So thanks for being a part of the solution. Thank you. Now I'd like to call on Commissioner Mike Preece for comments.
Thank you, Commissioner. Good afternoon, everyone. This opioid crisis in the United States knows no boundaries, no age, no color, no socioeconomic boundaries. It's here, and it's here to stay. And I want to thank CVS for not just talking the talk, but walking the walk And one of these boxes right here throughout the Commonwealth and specifically here in Dauphin County is proof positive that you are committed to the residents of Dauphin County, and we cannot say thank you enough. Our county coroner, Graham Hetrick, has many times said we're the wealthiest nation, most prosperous nation in the history of the world. So why do our residents continue to self-anesthetize themselves to the point that their heart stops beating? That's a question that has yet to be answered. He's working on it. We're working on it. CVS is working on it. Aetna Healthcare and others are working on it. Thank you so much for your leadership. This is the least we can do. Representative Mehaffie, thank you, and Chief Tom Carter and the law enforcement community for all that you're doing, putting this on the front burner so that folks throughout the community and throughout the Commonwealth are aware of this scourge, this epidemic that is upon society. Thank you.
So thank you, Representative Mehaffie and the Dauphin County Commissioners. We appreciate your collaboration and serving as a leading voice of the issue of the opioid diversion, misuse, and abuse. As we know all too well, the opioid challenge is a complicated one that didn't begin overnight and won't be solved overnight. Another example is our Pharmacist Teach program. Through this program, our pharmacists speak to students at local schools about the dangers of abusing prescription drugs. Here in Pennsylvania, we have hosted over 800 presentations, reaching more than 30,000 students and parents on this important message, and over 500,000 nationwide. We've also increased the access to the overdose reversal drug naloxone in 48 states and in Washington, D.C., including Pennsylvania. As a result, patients can obtain this life-saving medication, which is a safe and effective antidote to opioid overdoses, without an individual prescription in these states. We're proud of our community and law enforcement partnerships and the impact that we are making together. And we are dedicated to continuing our work to help fight the misuse of prescription drugs here in Pennsylvania and across this country. Thank you for joining us here today, and this concludes our event. If you have any other questions, we'd be happy to take them individually. Thank you.